Good afternoon, everyone, and thank you so much for joining this symposium today. I'd like to offer a special thank you to the organizers of today's event, Rear Admiral Felicia Collins and her team in the Office of Minority Health, and Admiral Giroir and the larger OMH team. I'm also grateful to all of the presenters today who will offer their incredibly valuable perspectives about what's working in their communities. Today's event is a vital opportunity to discuss what must be a core of our response to COVID-19 and to our efforts to improve American health more generally: the health and well-being of racial and ethnic minorities. It's little surprise that thousands of healthcare and public health professionals are joining us today to be a part of this important conversation. We know that we have daunting challenges in front of us. COVID-19 has laid bare pre-existing health disparities in a deadly way, with Black Americans, Hispanic Americans, and American Indians and Alaska Natives being hospitalized at rates several times that of white Americans. We've known about these disparities for a long time. Decades of systemic health and social inequities have contributed to a higher prevalence of underlying health conditions like diabetes and cardiovascular disease that put Americans of color at especially high risk of severe illness from COVID-19, including, tragically, at younger ages. Americans of color are also often at higher risk for contracting the virus because they are disproportionately likely to be frontline workers exposed to more potential sources of infection. That's why the entire Trump administration has put a special priority on supporting communities of color in our COVID-19 response. With funding from HHS's Provider Relief Fund, we've sent more than $13 billion to safety net hospitals, which disproportionately serve minority patients. We've required demographic data on all COVID-19 test results reported because all effective public health efforts run on data. We've supported hundreds of community-based testing sites in places identified as vulnerable by the CDC. More than 90% of community health centers, often trusted and convenient providers in disadvantaged communities, now offer testing. Thanks to innovative thinking by the Office of Minority Health, we awarded a major contract to the Morehouse School of Medicine to construct a strategic network of trusted organizations that will help disseminate information and strategies for combating COVID-19 in communities of color. Finally, we are working directly within minority communities to ensure representation in vaccine clinical trials and to build trust in an eventual vaccine. We've supported NIH and the COVID Prevention Network in launching ad campaigns to encourage enrollment. Together, we will beat COVID-19. But once we've done so, so many tragic and unacceptable health disparities will remain. Tackling health issues that have a disproportionate impact on Americans of color has been a priority throughout my time at HHS and for our entire team, and that will continue to be the case. Building on the pandemic response efforts, CDC is working to improve the quality of public health data for minority populations. Last year, we launched an unprecedented initiative to transform American kidney health by preventing kidney failure, improving dialysis options, and delivering more life-changing transplants. We're hard at work on a cure for sickle cell disease, which we believe could arrive within the decade. We recently launched a rural action plan that will include a special focus on improving health for rural Americans of color, including American Indians and Alaska Natives. And last year, the President launched an effort to end the HIV epidemic in America by 2030 by working closely with disproportionately impacted communities. We have a great deal of work to do, both to beat COVID-19 and to tackle these broader challenges. But I'm inspired that so many of you are eagerly bringing your experiences and ideas to today's symposium. This summer, so many Americans, myself included, have been reminded of how far we have to go in building a more just and more equal country. That's a key part of our mission at HHS, and I look forward to continued work to achieve that goal with all of you. Thank you again for joining us, and I wish you all a productive set of discussions today.
Good afternoon. I am Rear Admiral Felicia Collins, and I am honored to serve as the Department of Health and Human Services Deputy Assistant Secretary for Minority Health and the Director of the Office of Minority Health. Thank you, Secretary Azar, for getting us started on this exciting day. I also want to thank each of you for joining us for this virtual symposium and for the invaluable work you do every day within our states, territories, tribal communities, and neighborhoods to serve communities that often bear a disproportionate burden related to COVID-19 and other health challenges. Our mission at the Office of Minority Health is to serve those same communities by supporting efforts that improve the health of racial and ethnic minority and American Indian and Alaska Native populations. The Office of Minority Health supports health and other information dissemination within these communities, and we establish partnerships and fund grants and contracts to evaluate interventions and assess the effectiveness in reducing health disparities. These partnerships, both formal and informal, with organizations striving to advance health equity, are even more important as we meet the current public health challenge that disproportionately impacts our communities. The data show that our communities are disproportionately testing positive for COVID-19, disproportionately being hospitalized, and most importantly, disproportionately dying. And we know the devastating outcomes that our communities are experiencing are born out of systemic social inequities which continue to exact a heavy burden on our communities across the country. I personally have lost family members and close family friends to COVID-19, and so I want to pause and extend my heartfelt sympathy to those of you who likewise have lost loved ones, colleagues, and friends. However, I trust and believe in the inner strength of our communities. And although we are confronted by a deadly pandemic and oftentimes have limited resources, I have heard how state and local public health leaders, organizers, advocates, and community-based organizations have all risen to this challenge. They have done so with innovation, with caring, with commitment, and with determination. It is these experiences and perspectives, lessons and successes, that we are highlighting today during our virtual symposium entitled Advancing the Response to COVID-19, Sharing Promising Programs and Practices for Racial and Ethnic Minority Communities. During today's event, you are going to hear presentations from a broad spectrum of leaders and public health officials who are working in states and cities and territories and tribal communities to address the disproportionate impact of COVID-19 among racial and ethnic minority and American Indian and Alaska Native populations. Our presenters will cover a wide range of topics, from the use of racial and ethnic data to inform equitable pandemic responses, to approaches at the local level informed by cultural and linguistic norms and expectations, to the use of COVID testing data stratified by racial and ethnic demographics to design effective responses that meet people where they are and provide solutions that address their unique set of circumstances. Before leaving the virtual symposium, I invite you to stop by the virtual resource hall that has additional tools and resources. There's also a link there for you to become a part of a learning community to support continued networking and peer-to-peer information sharing about state, tribal, territorial, and local approaches to COVID-19 response, recovery, and resilience. We invite you to use and share these tools and resources in your home communities and beyond so we can slow the spread of COVID through the spread of successful practices. And while we hope you'll be encouraged and inspired by the presenters' examples, insights, and determination to help improve the lives of people in our communities, we more importantly hope you will put that inspiration into action. Each of our presenters today possess insights and strategies that I believe can be successfully applied to other communities across the nation. So our goal is that each of you will put that inspiration into action by bringing what we learned today back to your home communities and sharing what you learned with individuals in your neighboring communities, neighboring states, and beyond. The late civil rights icon, Congressman John Lewis, in all of his wisdom and optimism, summed up the powerful potential of communities when he said, and I quote, "Nothing can stop the power of a committed and determined people to make a difference in our society." Our participation in this virtual symposium and the actions we will take afterwards are an opportunity to demonstrate our commitment and determination to support COVID-19 response, recovery, and resilience in our racial and ethnic minority and American Indian and Alaska Native communities. Before we move to our keynote address, I want to take a moment to acknowledge the recent passing of Ms. Cheryl A. Boyce, a pioneer and giant in the health equity movement. Even if you haven't heard her name, you have probably been touched by her work. Ms. Boyce was the executive director of the Ohio Commission on Minority Health for 24 years and helped more than 30 states replicate the State Office of Minority Health model that she established. She was also a founder of the National Association for State Offices of Minority Health and founder of the Ohio Federation for Health Equity and Social Justice, a nonprofit committed to the promotion of health equity through the reduction of disparities. Ms. Boyce was a trailblazer, a thought leader, and a tireless advocate for our communities. 5 years ago, when she spoke at the Office of Minority Health celebration of the 30th anniversary of the landmark Department of Health and Human Services Secretary's Task Force on Black and Minority Health, she said, and I quote, "Everybody has a role in this and brings something to the table." Everybody has a role. That truth can help guide our efforts today and when we return to our communities. We hold her family in our thoughts and our prayers and honor her incredible legacy today as we continue to push towards health equity for all. Now, it is my pleasure to introduce the Department of Health and Human Services Assistant Secretary for Health, Admiral Brett P. Giroir. In brief, in addition to his role as the Assistant Secretary for Health, Admiral Giroir serves as the Secretary's principal public health and science advisor, and he represents the United States on the World Health Organization Executive Board. In March of 2020, he was appointed to lead the coordination of COVID-19 testing efforts across the Department of Health and Human Services. A fellow pediatrician, Admiral Giroir has been an unwavering supporter of the Office of Minority Health. Please join me in warmly welcoming Admiral Brett P. Giroir.
Good afternoon, everyone, and thank you, Rear Admiral Collins and the entire Office of Minority Health for hosting this important event and for bringing together an impressive assembly of leaders from across the country to highlight the pioneering work occurring in states, territories, tribal communities, and towns to lead America to healthier lives. Our partners are vital, truly essential, to the U.S. Department of Health and Human Services and my office, the Office of the Assistant Secretary for Health. We all have specific roles and responsibilities for ensuring that we achieve our vision, that everyone has a fair and realistic opportunity to reach their full health potential. This shared vision informs the work that we do, the initiatives we support, and the strategies and interventions we help to advance. But our ability to move forward hinges on our success in addressing the myriad of health disparities that have historically impacted racial and ethnic minority populations and plagued our nation for decades, if not centuries. The recent global pandemic has heightened the awareness of America's health disparities. The data show that underlying social determinants of health and disparate burdens of chronic medical conditions are primary contributors to worse COVID-related outcomes among minority and socially vulnerable communities. Reducing health disparities is a key part of the overall mission of my office, and responding to the needs that coronavirus has exposed and exacerbated motivates our efforts to an even greater level. OMH is one of the most important offices that are part of the HHS response to the pandemic. Whether OMH is working to provide access to testing or enabling equitable distribution of hundreds of millions of doses of a safe and effective vaccine, all of us understand the importance of partners in serving each and every community. I want to highlight an important project, one that I am very enthusiastic about as a program, but also as an example: the National Infrastructure for Mitigating the Impact of COVID-19 within Racial and Ethnic Minority Communities, also referred to as NIMIC. In July, OMH partnered with the Morehouse School of Medicine to coordinate a strategic network of all levels of government and local organizations, including historically Black universities and Hispanic-serving institutions, to deliver COVID-19 related information to communities hardest hit by the pandemic. NIMIC is creating a network of national, tribal, state, local, and grassroots organizations, including trusted community voices, to disseminate common, important public health messages and information about COVID-19. This effort will also use innovative technology to link individuals and communities hardest hit by COVID-19 to testing, vaccination, and other related healthcare and social services. NIMIC will further build on the strong foundation we have built to expand access to COVID testing in minority and disadvantaged communities. Regulatory revisions led by OASH have made it possible for pharmacists to order and administer COVID-19 tests from a trusted neighborhood pharmacy. This is important because for many Americans, their local pharmacist is their first point of contact with a healthcare professional. To date, more than 720 pharmacy and retail locations in 48 states in the District of Columbia are participating in the retail partnership to provide testing. And more than 60% of these retail pharmacy sites are located in underserved and socially vulnerable locations across the country. To further protect underserved communities and to promote safe opening of schools, just weeks ago, HHS and the Department of Defense awarded a contract worth $760 million to Abbott to deliver 150 million rapid COVID tests that can be administered at the point of care. Each test costs just $5, and 48 million of them will be available every month all throughout the country. This is another important key to protecting at-risk populations like Hispanics, Native Americans, African Americans, and patients in nursing homes and long-term care facilities. It is also important because the majority of these tests will be provided to governors to help open schools. And when schools are not open, we know that educational and economic disparities get worse. And because the best responses are preemptive and preventive, last month we launched the Catch Up to Get Ahead campaign, urging healthcare providers and parents to get their children their routine shots, especially now during the pandemic. As we confront COVID-19, we cannot let our guard down against preventable childhood diseases. We know that catching children up on their immunizations will mitigate pressures on our healthcare system when the influenza and coronavirus begin co-circulating in the coming months. And to support accessible immunizations, HHS issued a third amendment to the PrEP declaration that allows pharmacists all across the country to provide ACIP-recommended vaccines to children over 3 years of age. And stay tuned. There is more to come using this powerful authority under the public health emergency. So as you can tell, through all of the work that has been done, we have advanced the ball, but there is still important work to be done. It is one of the reasons I'm excited about this symposium, and I'm pleased you're able to join us. By being a part of this virtual symposium, by lending your voice and perspective and engaging, you have become part of a results-driven collective aimed at optimizing our responses to the pandemic. We would like you to take these tools with you and put them to work in your communities. Each one of you can make a difference to help slow the spread of COVID-19 reduce health disparities, and improve COVID-19 related outcomes. This is our chance to chart the path forward to a society that emerges post-pandemic stronger and healthier than ever before. Now let's get to work. Thank you.